Good evening. I am Dr. Singhania, Rohit Singhania from Connecticut GI, and I work at ECHN and Prospect. Today, I will be talking about colon cancer, and thank you for coming and joining the talk. I'm one of the gastroenterologists, and I'm also the chief of gastroenterology at Manchester Memorial Hospital. So we'll be talking about colon cancer, understanding the risk factors, symptoms, and screening options, and how can we prevent this malady. So this is a slide for the references I have used. I've used the slide deck from American College of Gastroenterology, which is the premier gastroenterology organization and is based on the latest 2021 guidelines for colorectal cancer screening. So what is colon cancer? Let me just minimize this slide on the side. Okay, all right. So colorectal cancer, you can prevent it. In the United States, colorectal cancer is the third most common cancer in both men and women, yet it is one of the most preventable types of cancer. So it is one of the third most common cancer in both men and women. About 150,000 cases of colon cancer are diagnosed every single year and resulting in 50,000 deaths every year. It is among the top 3 cancers and second leading cause of death from cancer. Regular screening, however, and removal of growths in the colon called polyps reduces the risk of developing colorectal cancer by up to 90% with colonoscopy. This is a cartoon from one of our textbooks, which shows the incidence and prevalence of colon cancer across the world. And as you can see here, this is both for men and women. And on the left is the slide for men, and then the right is for women. And as you can see, most of the top sites are in United States and the Western world. France, Italy, there are about 35 cases per 100,000 per year, and about 29 cases per 100,000 per year for women. And as most of the countries are in the Western hemisphere, and below there are China, Singapore, Colombia, India, Kuwait. Those have much lower risk. The reasons for this are not clearly understood. So what common cancer can you prevent with screening? These are some of the most common cancers. For example, the prostate cancer. No, you cannot prevent it by screening. You can detect it by a blood test, and that blood test is not very good at detecting it, but it has its limitations. Breast cancer, you cannot prevent this with screening. You can detect early cancer through mammography and other means. However, colorectal cancer is the one cancer that can be prevented with screening. It is not just that we can detect this cancer, it can be prevented via colonoscopy. Why is this colorectal cancer screening important? Because the key point is you can prevent it, not just detect colorectal cancer. And the test of choice is colonoscopy. How do we do this? By removing precancerous growths in the colon called polyps. Screening by colonoscopy with polyp removal prevents colorectal cancer before it can start. This is the power of prevention. Now, what is the colon? This is a cartoon that represents and shows us the diagram of the colon, which is also called the large intestine. As you can see here, let me see if I can, there is the bottom is the rectum, and the rest of it is called the colon. So colon and rectum. The colon has several parts, the S-shaped sigmoid, this area descending, transverse just from the orientation and the passage of stool, and ascending colon and cecum. The appendix is attached on the right side of the colon, and it joins the small intestine called the ileum. So stool comes from the ileum, it goes into the cecum, enters the ascending colon, meaning it's going up. That's why it's named ascending. Then the transverse colon, this is how it is in our body, then descends, and then it accumulates in the rectum from where we let out the stool. So according to the physicians from the American College of Gastroenterology, screening by colonoscopy and polyp removal prevents colorectal cancer before it can start. So how does this start? Let's go into a little bit more detail about colorectal cancer. This usually starts as a benign growth, a polyp that arises from the innermost layer of the intestine, which is called the mucosa. If the cells spread into the first layer below the mucosa, called the submucosa, then cancer is present. So as you can see in this cartoon, starting from the left, it starts as a tiny little growth of cells, which is an abnormal proliferation. Over a period of time, it slowly grows into a small adenomatous polyp, a large adenomatous polyp. Then it develops a finding called dysplasia. It is still benign until this point. This is a very slow process, taking years to happen. And that's why it gives us an opportunity to look at these growths, find them, and remove them. And then once it transitions from dysplasia to adenocarcinoma and cancer, that's where the problem starts. And this is called a malignant lesion. Okay, this can spread in the body and reduce your lifespan. This is a representation of the molecular aspects of the changes that happen in these cells. As you can see on the left, there is normal epithelium or the lining of the intestine. Slowly, it can develop mutations like the APC and these others, and it can cause formation of abnormal lining called dysplasia. This develops into early adenoma as more mutations in the genetic material, which is the building block of life in the cells. They accumulate, these abnormalities keep accumulating, and this adenoma starts growing and becoming a cancer. And bottom graph shows how the number of genetic alterations accumulate, and over time, this sequence progresses from normal to adenoma and to carcinoma progression. This is thought to take somewhere around 8 to 10 years to progress in this manner. Now, this is a more detailed diagram of a carcinoma in a polyp. Here you can see more clearly the linings of the colon, the layers of the colon. There are 4 layers. So this innermost one, I hope you can see my pointer, is the epithelium. Below that is the muscularis mucosa, a little muscle-like layer. Then there is submucosa, which is basically named as below the mucosa. And then there is the muscle layer. So carcinoma or cancer can be 2 types. When it is limited to this epithelium, it is still not invasive. It is not considered invasive. But once it crosses this barrier of muscularis mucosa, it becomes invasive, meaning it has a very high chance of spreading from here into the rest of the body. Usually the liver, lungs, bone are common areas where this can spread. So this is a really important area to know about. And since this develops in the polyp or adenoma, removing that polyp helps prevent this from ever happening. So more about colon polyps. A polyp is a small clump of cells on the lining of the colon. Most colon polyps, fortunately, are harmless, but it is difficult to tell them apart. Some colon polyps can develop into colon or rectal cancer, which is often fatal when found in its later stages. Now, importantly, not all polyps turn into cancer, but we do know this, that all cancers do start as polyps. Because colon polyps do not usually cause symptoms, meaning you can't know whether you have one or not, it is important to have regular colorectal screening, such as colonoscopy, which can go find these lesions. Remember, screening by colonoscopy with polyp removal prevents colorectal cancer before it can even start. This is a diagram and pictures of various polyps. They come in different shapes and sizes to give you an idea. They can be granular and spread out. They can also appear like a mushroom here on the upper right picture with a little stalk and a polyp on top. They look abnormal compared to the surrounding lining. There's another one of, relatively spreading flatter like lesion, and the bottom one on the right side at the bottom is what is called a flat polyp. It is very difficult to see. Some of these polyps are hard to see due to their flat nature, as you can see on the left picture, or them being hidden behind folds, as you can see in the right picture. This is a colonoscope shaft, and it's curved on itself, and it is finding this polyp that is behind the fold. So physicians from American College of Gastroenterology want you to know that screening tests can find precancerous polyps so they can be removed before they turn into colorectal cancer. Okay, screening tests are of several kinds. However, colonoscopy is the only screening test that allows both identification with a high degree of certainty and removal of polyps. This is a two-step process, identification and removal. Removal of polyps is called polypectomy. Therefore, colonoscopy is a powerful cancer prevention tool. Removal of polyps can prevent up to 90% of colorectal cancers, and with appropriate follow-up, the chance of death from colorectal cancer is significantly reduced. How is a colonoscopy done? The colonoscope is a camera, as shown in this diagram. It is at the end of a long tube, and we pass it from the bottom while you're asleep and comfortable. You don't feel anything. And we take a look inside. It has a light source and a camera built into it. As we pass in the colon, we can look at the lining and find out these polyps, and using instruments that are passed through the colonoscope, remove these polyps. Now, where do these polyps mostly occur? So this is a diagram that shows the occurrence of colon cancer / polyps or cancerous polyps. In the rectum or the last portion of the colon, about 20% of polyps occur, 25% in the sigmoid colon, 5% on the descending colon, and transverse and ascending colon cecum, they make up to about 40% of the precancerous polyps, or even colon cancer. So this transverse colon and ascending colon make the right colon, and this descending colon, sigmoid colon, and rectum constitute the left colon. Now, another diagram, sequence of images to show you how polyps are removed on colonoscopy. So up top on the left side, we find a polyp using a colonoscope. Then on the upper right image, you see there is an injection that has been injected to lift up the polyp, and there's a little hint of dye underneath it. Okay. Then using our electrocautery and other techniques from our instruments, we remove the polyp. So on the lower left side, you can see that the polyp is gone, and we can see that submucosal lining. And on the right side at the bottom, you see that area where the polyp was removed, and the polyp is floating in the colon, and then we remove it with our instruments. Now, understanding who is at risk of colon cancer. Colorectal cancer affects both men and women almost equally. 1 in 23 men have a lifetime risk of colorectal cancer, and 1 in 25 women have a lifetime risk of colorectal cancer. The year 1990 is important for risk of colorectal cancer. Why is that? Because new estimates show that people born around 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer than those were born around 1950. So more younger individuals. While the reasons for these trends are complex, experts suggest maybe it's the change in a diet to an unhealthy diet and sedentary lifestyle may be the contributing factors. Some other factors that can increase the risk are family history of colorectal cancer. If your father, mother, or siblings have had a cancer, that can increase the risk. Uncles, aunts, grandparents, which are called second-degree relatives, are also having a cancer or polyps can increase the risk of your cancer. Family history of adenomas or polyps, which are the precancerous kind of polyps, can also increase the risk of cancer. Other factors are cigarette smoking, obesity, Gallbladder removal can expose the intestine to bile in a larger amount and possibly increase the risk. Physical inactivity, abdominal radiation as a treatment for other forms of cancer can increase the risk. Cancer of the uterus or ovaries before age 50 can lead to increased risk of colon cancer. Inflammatory bowel diseases called ulcerative colitis or Crohn's colitis, which cause diarrhea and bleeding, can also increase the risk. And race, African American race itself can cause increased risk of cancer relative to other races. Now, I thought you would like this: foods that can fight colon cancer risk, something about your diet. What can lower risk? Folic acid, dairy products, fiber, and fruits and vegetables. 3 to 5 servings of fruit and vegetables. In fact, I did a paper on this many years ago, reduces the risk of colon polyp development. These should be fresh fruits and vegetables. More research is needed on tea, garlic, onions, vitamin D, fish and omega-3, vitamin A and B, and other substances. However, there is no evidence to date that vitamin E, vitamin C, multivitamins, or beta carotene or selenium reduce the risk of colon cancer. That being said, these can have beneficial health effects, and there is little harm in taking a multivitamin on a regular basis. What raises the risk? In this red slide at the bottom, red and processed meat and alcohol. So excess alcohol, more frequent red and processed meat can increase it. This doesn't mean that you need to cut out red and processed meat or alcohol completely. Red meat has several benefits. It gives our body a very good source of protein. It also has lots of iron and other ingredients and is a good source of calories. So moderation is the key, but just know the fact that red meat and processed meat can increase the risk of colon cancer and polyps. So what are some of the ways? This was a study done by, calculated by an organization in the United Kingdom. I thought this was very interesting. 6 ways to reduce your risk of bowel cancer and the number of UK cases that could be prevented. They said if you eat less processed and red meat, up to 8,800 cases could be prevented. If you keep a healthy weight, you could reduce 5,400 cases. Eating more fiber, drinking less alcohol, being smoke-free, and being more active could save about another 12,000 cases from becoming cancer. So more than half of all bowel cancers could be prevented each year just by a healthy lifestyle. It's powerful. So moving on, symptoms and colon cancer. All right. What are the symptoms and signs of colorectal cancer? Most early colorectal cancers, they produce no symptoms. That is why screening for colorectal cancer is so very important. Never ignore new or worrying symptoms, however. Reach out to your healthcare providers if you have a symptom, regardless of age. Patient question: should I wait until I get symptoms to get checked for colorectal cancer? No, absolutely not. Do not hesitate to talk to your healthcare provider team about symptoms, even those that seem hard to discuss or share, including, for example, blood in stool. This can be from polyps or cancer. Change in bowel habits, meaning you can have change from your baseline leading to constipation or diarrhea or variability in your stools. Changes in the shape and size of stool. Okay, a growth inside the colon can alter the size and shape of the stool. Rectal pain, abdominal pain, unexpected weight loss. This is very important to remember. And unexplained or new anemia, which is a drop in your blood counts. This usually can be found out by regular follow-up on your annual visit to your primary care. They'll check some blood work, and that's the reason. Any drop or changes in your blood work can indicate that something else is going on. So what should I do if I don't have any symptoms of colorectal cancer? You should get screened. Screening means getting checked even if you have no symptoms. So let's go to screening and colorectal cancer. What does that mean? What are our options for screening? So we have one-step screening versus two-step screening for colorectal cancer. The American College of Gastroenterology in 2021 guidelines on colorectal cancer screening explain the difference between recommended tests that are one step, meaning one and done, and two steps. In many instances, the best screening test is the one that gets done. Whatever you can do, you should do, and then we'll compare about the options of this. One-step screening test is called colonoscopy. Colonoscopy is a one-step test. We can look for growths called polyps in your entire colon and rectum using a colonoscope. We can detect and remove these polyps during colonoscopy and prevent cancer. Colonoscopy is one of the most commonly performed gastrointestinal procedure in the United States. Most places you will get sedation, you will not feel anything. Colonoscopy with removal of polyps offers long-term protection against developing colorectal cancer or dying from it. There are some new data that are also indicating that that benefit can last sometimes up to 20 years out. Two-step screening tests. These are stool-based tests and imaging tests. Let's talk about stool-based tests. These are tests to detect blood or altered DNA in the stool. As a first step, if this comes back positive, a positive result would lead to the second step of colonoscopy for further examination. One of these tests is called the FIT test. It's fecal immunochemical test, and it detects hidden blood in the stool, blood that you cannot see, which is so little in quantity that you cannot see. The stool FIT test is typically performed on an annual basis, meaning you need to do it every single year starting at a certain age. A positive test requires a follow-up colonoscopy. And the stool test is good at detecting colon cancer, but not so good at detecting polyps. It can detect some polyps, but not to a high degree of, it cannot detect all polyps. Multi-target stool DNA test. This is a new kind of test. This is a non-invasive screening modality that looks for abnormal DNA associated with colon cancer or precancerous polyps. This is more sensitive than the FIT test in picking up polyps and cancer, but your chance of getting a false positive test may increase with advancing age as the cells in the intestine get older or they start exhibiting mutations. Mutations are it's an abnormal process, but normal part of normal aging. If the multi-target stool DNA test is negative, then you repeat it every 3 years. Okay, if it is positive, then you get colonoscopy as the second step, which is required. Currently, there's only one FDA-approved multi-target stool DNA test, which is called Cologuard. You must have seen the ads on television. So what are the options for people who cannot or will not have a colonoscopy or do a stool-based FIT test or are not candidates for a colonoscopy, meaning they just can't clean out as part of the colonoscopy prep? Then they can get CT imaging studies, which is a CT colonography. It's a scanning test that looks at the colon for polyps, or a colon capsule. This is a capsule-based shaped pill, which has a camera and a light source built in. You swallow it from your mouth, it goes inside, it takes pictures of the colon. And that's how it helps detect polyps and cancer. At this time, CT colonography and colon capsule are options for individuals unwilling or unable to undergo colonoscopy or the stool-based FIT test, provided that the tests are locally available and reimbursed by insurers for screening. It is important to note that both tests will still require a follow-up colonoscopy if they are positive. In addition, these tests also require the clean out for the colon to clean this out so that the capsule and the CT can pick up those findings. And CT, in addition, requires exposure to radiation, and they have to put up a catheter up your bottom to inflate the intestine so the CT can get good pictures. All right, let's compare one-step versus two-step colorectal cancer screening. So on the left is the one-step test. You get your colonoscopy, your doctor can see and remove precancers called polyps and prevent or detect colon cancer all in one step, one and done. The two-step test approach, you can do a stool-based test like a FIT or fecal immunochemical test or multi-target stool DNA test, or you can do a flexible sigmoidoscopy. This is a camera that goes up your bottom, but only examines the left side of the intestine. This used to be done in the past. It's more or less fallen out of favor. Imaging test, CT colonography and colon capsule, as we just discussed. And if these tests are positive, then the second step required is colonoscopy. Now, if these are negative, then you have to repeat these tests. And they have a variable 1 to 5 years is usually the repeat interval. Now, I just wanted to present this slide also to show you how the colon cancer incidence is applicable across ages in the United States and why do we do what we do. So less than 40 age group, the colon cancer risk is pretty low, less than 3-4%. As we get into the 40s and 50s and 60s, the risk of colon cancer rises. And it goes up to almost 30% by the age of 70 to 79. And then it starts to decrease later because people have already passed away or other reasons. Screening recommendations from the American College of Gastroenterologists. So currently, we recommend colorectal cancer screening in average risk individuals between age 45 and 75 years to reduce precancerous growths called advanced adenomas, reduce colorectal cancer, and reduce death from colorectal cancer. We do suggest that a decision to continue screening beyond 75 years be personalized, depending on your overall health at that time. And generally, this is if you're healthy and you have we calculate if you are expected to live 10 years or more, then we recommend colon cancer screening. We recommend colonoscopy and the fecal immunochemical test or FIT test as the primary methods of colon cancer screening. We suggest considering the following screening tests for individuals unable or unwilling to undergo colonoscopy or FIT test. And these include the flexible sigmoidoscopy, multi-target stool DNA test, also known as Cologuard test, CT colonography, or colon capsule. What is the recommended frequency for different screening tests? So colonoscopy is recommended here every 10 years. FIT test, stool test every 1 year. So every year. So you have to do it 10 times to get efficacy on this test. If one of these alternatives is used, we suggest these be done on this schedule. The multi-target stool DNA test is every 3 years. Flexible sigmoidoscopy, I would say it's more close to every 5 years. CT colonography, if you get it done and it's negative, the next one will be at 5 years. Colon capsule, every 5 years. There is also a blood-based test, meaning you draw a blood sample and that checks for colon cancer related thing. It's not fully developed yet and not sensitive to pick up abnormal polyps and cancer to a sufficient level. Hence, it has not been approved by FDA, and we suggest against using septin-9 test. It's called septin-9, and then it is not recommended as a colon cancer screening test. Next, screening for African Americans. African Americans are diagnosed with colorectal cancer at a younger age than other ethnic and racial groups. African Americans with colorectal cancer also have decreased survival compared to other ethnic racial groups. Therefore, ACG guidelines have recommended colorectal cancer screening in African Americans starting at age 45. Now, you might say the other age group is also 45. So for African Americans, it has been since for the last 20 years, it has been at age 45. For most people, it used to be 50 years, but because of the changing demographics, the age was changed to 45 to start screening for everybody. All right, so the bottom line is we recommend that African Americans begin colorectal cancer screening somewhat earlier than others with colonoscopy at age 45. Okay. So what about screening for patients who have a family history of colon cancer or polyps? For individuals with a family history, they are considered to be at higher risk, and they may need to talk with their healthcare provider to see if earlier or more frequent colonoscopy is required based on their risk calculation. Sometimes if you have multiple cancers in your family, like ovarian or uterine or at an early age, then genetic testing may be required to determine your risk of colon cancer if you have a strong family history, especially with younger age of affected relatives. This is very important. Like, for example, if a first degree relative like father, mother, or a sibling had colon cancer under 60 years of age, then we start colon cancer screening, and colonoscopy is the only option in that scenario at age 40 years or 10 years before the youngest person had cancer. Similarly, if two second degree relatives have had colon cancer, for example, your grandmother and an aunt, then also it's recommended to start colon cancer screening at 40 years of age. And sometimes we choose to do a colonoscopy every 5 years in those cases. So this is very important. People who are considered high risk with a family history of colon cancer or polyps, they need it more frequently. They need to start sooner. And the important point is the only test is colonoscopy is the option for them. The stool-based and imaging tests, they're only for average risk individuals to consider because they are not sufficiently good enough to detect polyps and colon cancer. Getting a screening test scheduled, how do we go about that? So how can I arrange colorectal cancer screening? If you would like to undergo colonoscopy, ask your doctor to refer you to a gastroenterologist. Gastroenterologists are specialists in diseases of the digestive system and in the performance of colonoscopy. To find a gastroenterologist near you, you can also go to the American College of Gastroenterology website, gi.org/patients/find a gastroenterologist. Okay, if you Google it, you can find it. To learn more, visit gi.org/colon cancer. This is the website from American College of Gastroenterologists that is dedicated to all the facts about colon cancer. Getting screened. So take control of your health. Make a plan to talk to your healthcare provider about a colorectal cancer screening, and please get checked. Don't put off preventative health screenings. Most importantly, remember to get screened. All right. So we move on to the no excuses slide. And what are some of the excuses that people have? All right. So one of the excuse number one, I feel fine. All right. Fact is, colon polyps and early colon cancer can develop silently without symptoms. Therefore, waiting until symptoms can occur can mean the cancer is more advanced and less likely to be curable. So what do we recommend? We recommend that you get your colonoscopy or another screening test done. Excuse number two, to avoid colonoscopy. I am healthy. Why should I get screened? Well, according to experts from the College of Gastroenterology, colorectal cancer screening is for healthy people. Screening is for healthy people. If we find a polyp, we remove it and we prevent it from becoming a problem like colorectal cancer. Excuse number three, no one in my family had colon cancer. Well, fact is, don't be the first. Roughly 5 in 100 people are destined to get colorectal cancer in their lifetime, even with no family history. We recommend colonoscopy as the preferred colorectal cancer prevention test. Fact number 4, I have no risk excuse number 4, I have no risk factors. The fact is, the single biggest modifiable risk factor for colorectal cancer is failure to be screened. You should get screened. And the preferred test is colonoscopy. Excuse number 5, only men get colon cancer. Fact is, colon cancer is an equal opportunity disease. Women have the same risk as men. So you should get your screening done. And the recommended screening is colonoscopy. All right. So we come to the last slide. So just a brief overview. This you can find on American College of Gastroenterology website. The conclusions: 45 is the new 50. New age to start screening is 45. Learn about your screening options for colon cancer, colorectal cancer, which is also, we call it colon cancer sometimes, as it is the third most common cancer. Most common in age 45 to 75. Sometimes age 75 plus also needs screening. Colonoscopy protects you for 10 years. Other tests, 1 year or 3 years. And why should you do this? Because polyps are growths that turn into cancer, giving us an opportunity to remove them and prevent cancer. All right, and 45 is the new 50, and you can prevent it. Thank you very much for listening.